Okay, I think we'll commence. Yuma Dara Nuna Dara Nunawal. I'm speaking to you today from the traditional lands of the Ngunnawal people here in the ACT, and I'd like to pay my respects to the traditional owners of the lands across Australia where we are all meeting today, and extend that respect to any First Nations people who are joining us on this webinar. I'm Elizabeth Flynn. I'm the lead for the Prostheses List Reform Task Force, and today's webinar is going to be about changes to the Prostheses List timeframes for this year and next, mainly this year. And I have with me here Jeff Storer from Projects Assured, and together we're going to walk you through what we have planned for the year to come. So just some housekeeping. We're using Slido to do the question and answer session. You can open Slido on the right-hand side of your screen by clicking on the link in the chat or using the QR code that you see on the right of your screen. We'll remind you again later in the seminar, but if you want to set up Slido now, you can. Please use the thumbs up button to vote for those questions you would like answered first, or type your own question. Questions can be posted at any time during the webinar, but they'll be answered after our presentation. So out of scope questions that aren't related to the topics that we're discussing today, will not be addressed at this webinar, but we'll give you some contact email addresses at the end where you can send those questions if they're burning for you. And you can access closed captions. They're located at the bottom left of the screen, and you click on the symbol, the CC symbol, you can turn them on or off. Okay, what to expect from this webinar today? We're giving you an overview of the timing and impact of bypassing the March 2024 update. Then we'll walk through information on the Prostheses List reforms and consultations planned for 2023. And the main part of the webinar is an opportunity for stakeholders to ask questions or raise concerns about the proposed changes. Now, we started communicating about these changes before Christmas when we sent an email to all of the sponsors, and we also sent out a message in a PHI bulletin. But we're following up with this webinar because we really want to reach as many people as possible who might be planning to put in an application for a listing in this year. So just a bit of a description of how the Prostheses List reforms are working together and interacting with the move to the Health Products Portal. On the left-hand side of the screen, you'll see there's a number of elements of the Prostheses List reform that will progress this year. The first one is the new application pathways that we consulted on last year. There are 3 new pathways, and we're defining those pathways for items that are eligible for inclusion on the Prostheses List and removing ineligible items. Those pathways were finalised in November 2022, and we're moving into implementation this year. The new grouping structure for the Prostheses List, you will know that we've been doing a lot of consulting on a new grouping structure, which we hope is has a clinical logic in it and is more simple for all of us to navigate. And we will be finalising that grouping structure by March 2023. We're just commencing some consultations on what the structure looks like in February. There are benefit reductions occurring this year, both in March and July. The ones in March are for the general use items, and the ones in July are the annual reductions that we're doing. It's the second year of reductions of a planned 3-year reduction program. And then we're updating cost recovery fees. So the updated cost recovery arrangements will take effect from the 1st of July, and of course there'll be consultation on that before it is finalised. So there's a lot of work in the reform space, and it will interact with the Health Products Portal. And I'll just hand over to Jeff Storer now, who'll talk more specifically about what's being planned for the Health Products Portal. Thanks, Jeff.
Thanks, Elizabeth. And most of you, or many of you, will have heard from us as part of the development of the Health Products Portal. We've written out to all members who have items listed on the Prostheses List, inviting them to participate in the process. And many of you have participated in that process, and we thank you for that contribution. An overview, the HPP is really a larger technological transformation and business transformation across the Department of Health, across all regulated and subsidised items. But specifically, In the devices space, we're looking to simplify the process of applying, tracking and paying and managing all regulated and reimbursed health products and services, and specifically devices. We have been working with the industry around the 3 application pathways, and many of you have participated in the beta exercise. And we have decided as part of the prostheses reform, as we bring new legislation into place, instead of building it into the old capability, we'll be putting that into the new technology. Many of industry have provided advice back to the department about some of the limitations of our existing technology. So we're starting to update that technology platform and business processes in line with the prosthesis reform changes. We will be in contact with industry specifically around the next phases of the development of the health product portal, again through the similar channels. But Elizabeth and I thought it's a good opportunity for make sure that people understand that there is a significant intersect between these two things. And one of the primary drivers around bypassing one of the application cycles is to ensure that we have a stable environment to implement both the new reforms part of the program and the technology part of the program. So this is the visual describing the activities over essentially the next year. And most of you will have seen this in one of the updates and also in recent correspondence from the department. And what we're showing is the overlap between the cycles. So currently the applications in January 2023 for the July cycle will be unchanged. The following cycle, which begins for the publishing cycle in November this year, again, will be largely unchanged. But it's the one that we refer to as the March publishing cycle, where applications are usually commence around May, is the one that we will be removing, which means that they will have an impact on people's ability to make new applications or managing existing applications, and they will be some of the questions that we will address today. And you can see on the left down the bottom, it's so that the reforms that are proposed, so the new application pathways finalised, the new grouping structure are finalised, and the new cost recovery arrangements are finalised, so that we can put that capability into the new system and have applications in the HPP commencing for the July 24 publishing cycle around September this year. But I'm sure there'll be some questions in more detail when we get to questions and answers at the end of the webinar. So what this means, for July and November, supported by PLMS using existing PL policy. So largely nothing will change. March 2024 cycle, so the publishing cycle, will be bypassed. And then in July 24 cycle, the full cycle will be supported by the new functionality and the new policy as part of the PL reforms package.
Okay, so now we're moving on to some information about the Prostheses List reforms and some of the consultations that we're planning this year. So first off, for listing pathways, I think most of you would know that we've designed 3 new pathways, Tier 1, Tier 2, Tier 3. The Tier 1 pathway is completely in-house and it's for medium or lower risk devices. The Tier 2 pathway is one that requires external clinical advice and in some cases health economics advice, and it will go to the advisory committee, which at the moment is PLARC, but PLARC is getting a bit of a makeover as well. And then the Tier 3 pathway is the one where the applicant will go directly to MSAC for novel technology, devices where there are no comparators, or there's no relevant MBS item. So all of that will be embedded in the new HPP. In the grouping structure, as you know, the prosthesis list comprises of, at the moment, 4 parts. Part A is the largest part, and that's where the medical devices reside. Part B is for human tissue products. Part C is for exceptional circumstances. And we created a Part D last year for the general use items, which will be removed from the 1st of July. That Part D is just for ease of identification, really. Now, Part A has been the subject of the regrouping that Herrico has been working on. We will also look to do regrouping for Part B, but that will come at a later date. So we'll just park that for the moment while we've engaged PwC to do some consultations on that area of the prostheses list. Part C is relatively small. The exceptional circumstances, that hasn't been, the structure there hasn't changed. And as I mentioned, Part D, those items will be removed. So most of the work is happening in Part A. And then cost recovery, we are moving to a new cost recovery regime that is compliant with the Australian government charging framework. It's interesting to note that cost recovery hasn't changed really for the prosthesis list since it was introduced in 2007. And if you compare that, for those of you who interact with TGA, you get new fees and charges and a consultation on that every year. So there's quite a striking difference between the prosthesis list and TGA. And we just want to modernise, I guess, the cost recovery arrangements, and there'll be further consultation on that in the first part of this year. The new cost recovery arrangements are scheduled to commence from the 1st of July, and they will be embedded, I guess, in the HPP. So we're also introducing quite a raft of legislative changes. Tranche 1 has been introduced into Parliament, and it will be debated in the first half of this year, we anticipate. That one was for the name change. We're renaming the prosthesis list the prescribed list of medical devices and human tissue products. So you can still shorten it to PL if you want to. We're introducing new definitions for medical devices and human tissue products, and also the cost recovery provisions. So they're all available and have been seen by stakeholders. In the first part of this year, we'll be working on Tranche 2, which is bundling arrangements for general use items on the PL, which will be taken out of the prosthesis list but will still be mandated in a different area of the Private Health Insurance Act, and we'll be consulting on that shortly. IHACPA, just an ad for them, IHACPA is running an information webinar tomorrow about the consultation on arrangements scheduled for the first quarter of 2023. And then listing criteria for Part A and Part C, we're modernising those as well, and we'll be doing consultation on them scheduled for the first quarter of 2023. And as I mentioned, cost recovery fees will be done in parallel with that. We've also introduced a more programmatic style of post-listing reviews, and we've kicked off the first 4 of those post-listing reviews. They are looking into surgical guides and biomodels, spinal cord stimulators, metal back patella, and urogynecological mesh devices. We've done targeted consultation with the sponsors of these device types, and we will continue to do that targeted consultation through the first half of 2023. And then when we identify further reviews, we'll let everybody know about that. We're just working on a program that makes sense. And then with these 4 first reviews, we're learning as we go about what works and what doesn't, and we'll feed those lessons into the post-listing review framework, which is available on our website at the moment. And then compliance. So we've consulted on a compliance strategy, and that consultation happened in October last year. We've looked at the feedback before finalising the strategy, and we'll put a response paper up on the website shortly, and you'll hear about that through a PHI bulletin. And then the compliance strategy and response paper will be published, as I said, in the first quarter of 2023. So the prosthesis list guide, as we change the listing pathways and the grouping structure, we have to update the guide as well. So we're in the process of developing that to assist applicants for the new application processes. The guide and the new listing criteria. The guide will be a reference point on how to collect and compile clinical evidence to meet government requirements. We'll be consulting on the guide in the first quarter of 2023. And we'd like to hold some workshops on developing successful applications so that people can understand what level of evidence is required for each of those Tier 1, Tier 2, Tier 3 pathways. So we'll do our best to help people to develop really successful applications. So here's a bit of a summary of the consultation schedule for 2023. The next thing you'll hear about is the IHACPA webinar tomorrow on bundling arrangements for the general use items. Then we'll do a webinar, the department will do a webinar to provide an overview of the regrouping approach to Part A and Part C, including methodology, to address the mixed benefit groups. And then we'll do consultation on the mixed benefit groups following that webinar. So we really want to set the scene with the webinar, and then we'll come out and consult with sponsors on what the mixed benefits groups might mean for their products. Then we'll do targeted consultation on regrouping for Part B. As I said, that's part of the work we've commissioned PwC to do. The Part B work is moving more slowly, I would say, than Part A and Part C, and it probably won't be concluded until late this year or next year. We'll also do targeted consultation on the pilot post-listing reviews. That will be with the impacted sponsors. We'll do consultation on the Prostheses List guide. That will kick off in this first quarter. We'll also be doing consultation on the tranche 2 of legislative changes, specifically the listing criteria and the bundling arrangements, as well as cost recovery. And then this is highlighted specifically because it's beta testing for PL Apply, and Jeff will talk about this more, I think. Or do you want to talk about it now?
Yeah, no, thanks, Elizabeth. Again, many of you have participated in the Tier 1 application beta process. We are going out for what we call public beta for the Tier 1, Tier 2 and Tier 3 public beta testing, where basically we enable industry to use the system in a lower environment in anger and then provide us with some feedback. So you'll get some detailed correspondence from the program team around how to participate in this. And we look forward to your continued support in it.
Thanks, Jeff. And then finally, in this first quarter, consultation on the bundling arrangements, again led by IHACPA. So there's the webinar tomorrow, but IHACPA are due to finalise those bundles in March. So it's sort of bookended, I guess, by the webinar tomorrow and then finalising it in March. And then the next quarter starts with targeted consultation on pilot post-listing reviews, again, and the consultation on the Prostheses List guide and various workshops, consultation on tranche 2 legislative changes, again, and sponsor participation in beta testing for PL Apply, again. Is that right?
Yes.
Yep, continue. And then consultation on the bundling arrangements for general use items by IHACPA will actually be finalised by then, so everyone will know the result in that second quarter. In the third quarter, again, consultation on post-listing review framework. That will be to circle back and see what we've learnt from the initial reviews that we've been doing. And then over to Jeff for the PL Apply user onboarding.
Yeah, and as I described earlier, we will be starting to use the new capability in September. And so we'll be running an activity where we'll be onboarding all users, so setting up user accounts and making sure that people have a good understanding through user guides, etc., on how to use the new application process. And then following on to that, we'll be running onboarding and training activities, so webinar series around where we actually run through each of the functionality and provide kind of hands-on support for people. And then moving into working with the hospitals insurers to participate in the publish process, private beta, so that we make sure that the information from those that use the information is available in the format in which they use it.
Thanks, Jeff. So that's the plan for this year. As you can see, there's a lot of consultation which is interrelated, but we're trying to, I guess, bundle it into bite-sized pieces for you through the year. So I think we might move on to the question and answer session. Now, we did invite you to send your questions through prior to the webinar, so we've picked out some of these to kick off the discussion while people might be typing in their questions in the system. So these are some questions that were received prior to the webinar. First one is, why does a PL update need to be bypassed? So I might kick off with that one. Obviously, where we've got a number of reform elements that are due to occur during the year, we can't embed those reform elements in the existing online system, PLMS. A lot of you will know if you use PLMS, it's quite unstable and it's just holding together at the moment, but it just won't tolerate all of the changes that are coming due to the reforms. So we need to plan to move to the HPP to make those reforms part of the new system. Jeff, have you got any other comment you'd like to make?
Yeah, only, Elizabeth, that the alignment between finalising the reforms in a timely way so that we can build that capability in the new system to support it, I think is the key reason. So it's the intersect between changes in legislation and changes in capability to support that legislation.
Great, thank you. So the next question we had was, what alternatives are available to submit an application during the bypass period? The short answer is there will be no alternative mechanism for submitting an application during this time. We don't run a paper-based system really, it's all done through PLMS at the moment. So our choices are PLMS and then HPP when we move over to it. So we're talking about a period of, it's probably between May and September this year, when we won't be able to accept new applications. So the next question, if the department will continue to have access to PLMS, can sponsors email the department to finalise add documents to an application on their behalf? Related questions are, what options are available to finalise applications that have already been recommended but are pending their ARTG or MBS number? And will transfer of sponsor applications be available? They're all related because I guess the fundamental question there is, you know, I'm almost through the system, I've got a small change that I want to make. What can we do about that during that period from May to September? So we're working through these questions and we'll provide answers in the coming months. It really depends on whether we can make those adjustments in PLMS or not. And there has to be, I guess I'm calling on Jeff now, but there has to be a sort of a cut-off period when we've got all of the data in PLMS and it's not going to change anymore, and then that transfers over to HPP. So that's what we're trying to juggle there.
Yeah, it's a really important point, Elizabeth, is maintaining data integrity through transition is fundamental success for all of us. So making sure that we have a stable current state so that we can transfer the data to new capability and people can seamlessly manage their items and also make application against the new application structure and the new grouping structure.
Mm-hmm. I guess I would also want to say that if you've got, obviously if you're waiting on an ARTG number or an MBS number, that's out of your hands, I understand that. But if you've got small changes or transfer a sponsor or that kind of thing to do, please do it now. Please get it done before May if you can. That would be our message.
And Elizabeth, I'll just add that as we work through trying to answer some of these questions, it is almost a case-by-case consideration because they are all unique in their own kind of limitation. So that's why we're kind of saying the answer is no, but if there are some things that we can get done in the short term, then that will certainly help everybody out.
Yes, we'll do our best to accommodate you. Okay. So here's another set. Oh, did we do all those ones? Yeah. Okay. Another set of three that are quite similar, or the answer is quite similar. If the department will continue to access PLMS, can sponsors email the department? No, we've done those ones, haven't we? Yep. Sorry. Yep. Done. All right, so I think we're handing over now to Jane, who's going to run us through the questions that we've received. So this is your opportunity to type it out. And just a reminder that you can access Slido through the QR code on your screen. And I'll hand over to Jane now. Thank you.
Thanks, Elizabeth. Thank you for reminding attendees that questions can only be asked through Slido and they will be moderated. There are a few ways to access Slido, firstly by opening the app on the right-hand side of the screen or by using the QR code and password on this slide. On the right-hand side of the screen, you will see the Slido bar, which will show the questions as they are approved. And we encourage you to use the thumbs up button to indicate the most popular questions to be addressed first. In the interest of timing and scope, the panel will only be addressing questions related to changes to the Prostheses List timeframes. So joining us today as the panel, they should pop up on the screen in a second. Well, we'll have Jeff Storer and Wendell Parry from the Health Products Portal team. And we'll have Elizabeth Flynn, Penny Parish, and Irina Suganova from the Prostheses List Reform Task Force. So if we're ready, our first question is, will there be a definition for high-risk products? Are we talking about classifications per TGA risk class?
As a general rule, yes, I think we are lining up with the risk classifications for, is it on? Yep. Yeah. Yes, we will try and align where possible with TGA.
Thanks, Elizabeth. All right, the next question is, what will be the difference between a clinical report submitted to TGA and one required by CAG?
Right. So, I mean, it's the same as occurs at the moment. I guess the main difference between what we do to consider listing on the PL compared to TGA is that we're looking for clinical comparators because we want to know that the device that you want listed is at least as effective as the group it's going into. So that's a different kind of assessment than the one that TGA does.
Thank you. Next question is, will the workshops mentioned on developing successful applications be relevant to Part B or only Part A, given the expected pace of Part B consultations?
I think in the first instance, they'll only be relevant to Part A. And if we identify a need to run workshops specifically for Part B, we'll do that later.
Thank you. All right, so what happens if legislation is delayed? What flexibility does the system have?
I don't anticipate the legislation is going to be delayed, but most of what we're embedding into the HPP, because this seminar is about, you know, what to expect in terms of your online applications this year, what we're embedding into the HPP isn't really dependent on the legislation.
Not significantly, no.
Will PL items reclassified as general use items be automatically transferred to the new arrangement, or will sponsors need to reapply?
Jane, can you just read that again? Will automatically be transferred to what?
To the new arrangement, or will sponsors need to reapply?
So the general use items in Part D will be removed from the prosthesis list as of 1st of July. So they won't be in the new system on the prosthesis list. They will be listed in a separate area of the Private Health Insurance Act, but they won't be on the PL anymore.
Next question is, as the March 2024 cycle is being bypassed, is it possible to have a May 2024 cycle in lieu?
I guess what we think we need to do is make an assessment about that a bit closer to the time. I don't know the capacity of, you know, participants here today to get an application into an earlier cycle, or, you know, like we don't know what the need will be come, you know, March next year, but we'll make an assessment of that as we move through the year, I think.
Thank you. All right, so will the criteria for moving an application from tier 1 to tier 2 or tier 3 be clearly laid out in the new PL guidelines?
Yes.
So this is a clarification question. Someone is asking if they can confirm when we say device, are we referring to both medical devices and human tissue products?
So at the moment, everything we're talking about is medical devices. There is a consultation that's just about to kick off around Part B, the human tissue products. So I think where we can align the two parts of the PL, we will, but I'm not going to draw any conclusions about that until the consultation has happened. So for the moment, the applications we're talking about are Part A applications. And so the initial focus is on Part A.
Just sticking with Part B, do you expect that results of the Part B consultation will be fed into a second update or consultation on the listing guide at a date later than currently planned?
Fed into the second update consultation.
Yes. I think, yes, the results of the Part B consultation, where they are signalling a need to update the guide, we will do a second update of the guide.
What platform will communications and or requests for information from the department to sponsors and sponsor responses be sent for May 23 submissions? Platform will be used.
For May 23 submission.
PLMS, yeah.
PLMS will still be used.
PLMS will still be functioning.
Can you confirm the May 2023 submission cycle deadline is the 14th of May with the PLMS open to submit?
Yes. Yes.
So I want to be clear. You have to get it in before the 14th of May. That's when, after the 14th of May is the period when we won't be accepting applications anymore.
The 14th of May deadline is for the November 2023 publication cycle. Does that make sense?
Yeah. So if you don't get your application in before the 14th of May, you will then have to wait until September.
Excellent. All right, so the next question is what documentation requirements, what are the documentation requirements for established and not established technologies? Are we talking about peer-reviewed publications?
I think that question is a little bit out of scope for this webinar. It's probably, you need to wait for our consultation on the PL guide.
Excellent. Just a quick one, I'm getting a lot of requests to make the slides available. So if we could just confirm that.
We'll be releasing the slides to the participants today, but also there's a recording that will be published for those that have been unable to participate today. So we'll be publishing the recording.
Thank you. So what are the top level changes or differences to HPP in comparison to PLMS?
I can answer that one, Jeff. So I guess the biggest changes between PLMS and the HPP are that we have the new pathway applications in the HPP. But there are other changes in the HPP to address current pain points with PLMS. to address the user experience and to make that better for all of the users of PLMS. But the best way to see, I'm going to have a plug here, the best way to see the changes between PLMS and the HPP is to participate in the upcoming public beta. You'll be able to jump into the HPP, experience it for yourself and provide us with some feedback. But I think you'll find that the HPP will be will definitely be more stable than PLMS and much easier to use as well. But please come and check it out for yourself.
Thanks, Lizelle. All right. So in regards to the March 24 PL, are there any benefit adjustments which will be delayed or skipped?
So there won't be a March 24 update, so therefore there won't be any reductions that we will anchor to that one.
Excellent. The initial beta testing was only for Tier 1. Will there be exposure to Tier 2 and 3 prior to public beta testing?
No. So you'll get to see the Tier 2 and Tier 3 applications in the public beta testing, and that will kick off with an introductory webinar that you'll be invited to attend. So we'll do a demo of that Tier 2 and 3, and then you'll be able to jump in and use the system in public beta.
Fantastic. I think that also answers the next question, which was how can we join the beta testing of the HPP?
Yes, so we'll be sending out an email to invite you to participate, and that will have the links to the webinars, so you'll be able to come along to those.
And will all billing code history and previous applications from the PLMS be transferred to the HPP?
That is a very good question. We are working through that, but it is our understanding. So all historical information is required by the department in order to make assessments. So that will be available to the department, but we're working through how we can make that available to sponsors to meet their requirements to view historical information as well. But obviously we've got a lot of things to consider given we're moving from one grouping structure to another, from one data model to another. So we're still working through that at the moment.
All right, so will there be changes in the timelines for small changes such as updating AR teaching only?
Okay, so I think this relates to a question we answered earlier, which is if you've just got a small something or other, can we help you out with that during this period when we're not accepting applications? We're exploring what PLMS might be able to accommodate there, but I can't give any guarantees at this time. So again, I would just encourage people, if you have small changes or changes of sponsors or something like that, please get it in before May, because the risk is that you might have to wait until September if you don't get it in by May. Now, I understand when you're waiting for an ARTG number, it's out of your control. It's just when you get it from TGA, but we cannot guarantee in that period that we can update those small changes.
All right, the next question, seeking clarification. The PLMS does remain open to submit applications by the deadline 10th of September. Therefore, these applications are assessed for a July 2024 PL.
Deadline 10th of September, therefore these applications are accepted.
No. So the deadline is on the 11th of September for the July 2024 publication, but that will be in the HPP. PLMS will no longer be available as of the 11th of September. So you'll need to lodge your applications for July 2024 in the HPP.
All right. So what are the details of post-listing reviews? Is this similar to TGA post-market arrangements?
So I just draw your attention to the fact that the post-listing review framework is available on our website. And it's really not, we're talking about the HPP and the bypass of the cycle in this webinar, but I would direct you to our website and search for the post-listing review framework.
Will the PL guide be embedded into the HPP before public beta testing?
Good question. I think with the timeframes, the consultation on the PL guide will probably be happening in parallel to our public beta testing.
Yep.
What we have in the health products portal is a suite of knowledge base articles, and we have some draft content in there for you to have a look at. So you'll be able to understand how the knowledge base articles will work, and then some of that guide content, once the consultation has completed, can be put into those knowledge base articles. So the HPP has in-context help, and some of the guide content will be either replicated in the HPP or just put in the HPP instead of in the guide. So really good question. We'd love for it to be there in public beta so you could test both at the same time, but the timing probably won't line up before public beta.
Will updates for general use items removed but under bundling be made via HPP, or will items falling under these categories be automatically updated as GUI?
So there won't be any updating of general use items once they're taken off of the prostheses list. The group that we have at the moment is the group. I think, what we're intending is that when we implement this new bundling arrangement separate to prostheses list, we'll do a review of how it's working after about 2 years, and we'll see where that takes us. But there won't be any routine updating of the bundles.
So what date is the HPP expected to be available for September deadline?
So I think I might have confused everybody a little bit here in a previous answer. So there's not a September deadline. So the September deadline would have been for the March cycle, which we're bypassing. So the HPP will be available on the 11th of September for the January deadline for the July publication cycle. So apologies if I've confused people, and I think Paul's question is similar in vein, the next question. So yes, the HPP will be available on the 11th of September for the deadline in January. And we'll make sure that you're all onboarded and you have heaps of support up until that September 11 date, where you'll be able to start jumping in and drafting your applications and lodging them through the HPP.
That's great. Thank you for clarifying and answering both those questions.
It's confusing. All these dates get a bit confusing.
So the next one is, will the same billing codes and all data be transferred to HPP system?
Yes, but of course the data, so we'll be getting the data out of PLMS, we'll then be transforming that data into the new grouping structure and then putting that new grouping structure into the HPP.
Just a few questions left. HPP current users, what are the requirements for the PL to be enabled at a user level?
Right, so thanks for this question, Stephanie. So Stephanie's already a user of the HPP. So you won't have to do anything. You'll just log on to the HPP as you usually do on the 11th of September, and you'll just see that the applications for Prostheses List will have appeared in the HPP. So for existing HPP users, you won't have to do anything. Your experience will be the same. You'll just start to be able to apply to the Prostheses List through the HPP on the 11th of September.
I'm not sure if that sort of answers the next one, which is, will we have an opportunity to test full functionality of HPP, including access to historical data prior to removal of PLMs?
It sounds like that's quite an important point. So we'll take that question away and have a think about that. We certainly can provide another round of testing. So we'll have a consideration of that and work out when we might be able to fit that in to the plan. So yeah, really good question. Thank you.
It's like Michelle Costa's got the same.
Yeah.
So our final question, which we have already answered, but just to confirm, the webinar and discussion will be made available.
Yes, they'll both be available on the website. We'll let you know through perhaps an email when they're up there.
Fantastic. So I don't have any more questions on my screen. If people want to take a moment to send in any final ones.
No, thanks, Jane. It looks like we've come to the end of the questions. We're doing a repeat of this webinar next week. If you've sat in on this one, you don't need to come to the one next week because we'll be doing it all over again. There's suddenly 2 more questions. So, Jane.
Excellent. Thank you, everybody. So which cycle will the new grouping structure appear?
July. The first one out of the HPP, which is July 24.
Fantastic. And do users need to re-register for HPP?
So if you're an existing HPP user, you won't need to re-register. But in order to start using the HPP, you will need to register using your MyGov ID. So we can't automatically transfer your PLMS registration over. So we'll help to take you through the process of registering in the HPP and linking your MyGov ID to your HPP profile. So all that we'll take you through all of that in the onboarding activities later this year.
Okay, looks like we've come to a pause again. Thank you very much, Jane, for helping us out there. And thank you to all the participants. That's been really helpful to us to identify your key concerns and things that we need to take away and have a bit more of a think about. We'll continue to pump out information about this. My hope is that we get the feedback that you've heard it all before, because we really want to make sure that we reach everybody who might be planning to put an application in of any sort this year, because they need to know about these changes that we've had to put in place for the big move. So final slide here is about getting in touch with us. We do have quite a number of email addresses depending on what your question is. I think the most important one out of this webinar is the Health Products Portal one. So for people who want to know how to register for the public beta and that kind of thing, there'll be communications coming out, but you've got an email address there in the middle. For those of you who are asking questions about the general use items and the bundling arrangements, there's an email there from iHACPA, and they are delivering a webinar tomorrow as well, which you should know about. And then for the Prostheses List reforms, if you have a question about applications, just BAU style questions about applications, there's an email address there. If you have a general question about the reforms, we have an email address. If you specifically want to know more about post-listing reviews, there's an email address. Or if you specifically want to know about compliance, there's a separate email address there. So I hope that will help you navigate your way to get the information that you need. As I said, we'll be repeating this webinar next week, but it is a repeat, so you don't have to sit in on both. And we'll continue to provide information to you frequently as we move through this year. So thank you all for your attendance. Bye.